Hello, everyone, and welcome to Team TSI's training today. Today is our special expert training, so you are in for a treat. Uh, During this COVID-19, as you may have been following, we've been trying to provide a helpful in something that could impact what you're doing day in and day out and could be being impacted by like focus survey with the COVID-19. So we have some wonderful resources, amazing experts and presenters today. So we're going to go ahead and get started. And the first thing is I want to make sure that you are able to ask questions and download the handouts. I did notice, and someone has brought to our attention that we are having a little bit of trouble with handout number 4 and it's not downloading. So we apologize for that. We'll be sending everyone the handouts here in just a moment. So if you hang in there, we'll get you the handouts. So the first thing I'd like for you to do is find your GoToWebinar panel. If it's collapsed or you're not seeing the panel, you can go and click the blue flower at the bottom of your screen. That will pop up your toolbar. Some of you may have collapsed your toolbar and it will look like my first picture, and you simply click on the orange arrow and it opens up to that picture number 1. Then when you're in your GoToWebinar panel, you're going to look for 2 lines, your questions line and your handouts line. The questions line, when you open that up, it will look like our picture number 2. That's where you'll type a question in for our team. When you hit send, we receive an alert with your question, and we'll be replying and answering your question throughout today's training. Now for the handouts, there are 5 handouts. When you click on handout, there's 5. And the first handout is the slides in PDF form for you. And then there's handouts that are numbered, and it says number 1, handout number 2, number 3, and number 4. And we are noticing that handout number 4 is giving us a little bit of an issue. So we're going to take care of that and send those over to you. So if you have any other questions, please feel free to reach out to any of us at any time, and we'd be happy to assist you. So today we're going to get started. I want to make sure we have plenty of time for all of the great information that we have in store for you today. If you're wondering, are we recording today's session? Yes, we are. So you'll also receive in your email, I believe it's tomorrow, in a follow-up email from GoToWebinar. You'll have the recording link in there. If it becomes available today, we can also send it out to you. So I'd like to introduce our team, and what you're seeing here is just the team that may be hands-on today, but there's also so many team members behind the scenes. So today you're going to hear from our Vice President of Informatics, Greg Seiple. He is really leading our team in so many different ways, and we have the assistance of Hugh Heaton, which is one of our experts that is a consultant, but you just wouldn't know. He's such a vital part of Team TSI, and I think you're going to be really excited with the information and the resources he's providing today. So in the background, you're going to see many hands involved in answering your questions today, and that could be from the support team, from myself, Dahlia Croft, from Kelsey Little, and we even have some of our other experts on the line to assist, like Pat Newberry and Jill Pugh. So you have a whole team with you, and with that, we're going to go ahead and get started. So I'm going to turn this over to Greg. Thanks, Greg. And Greg, you might be muted. Are you there?
I got to learn to work that mute button. My apologies. I've done that twice now. Do I have the keyboard control?
You sure do.
All right, great. So today's session and the goal is going to be really on the COVID-19 focus survey process. This is that newer process that came out in response to the pandemic, and how the Department of Health is focusing in on potential risk areas related to this. It's going to look at the focus areas that include offsite survey activities. What are they going to do from a preparation standpoint before they ever come into the building? What activities will be done on site as opposed to that off-site review? The entrance conference worksheet, the information they'll request within immediately or within an hour, and you'll find that there are really only R2 timeframes and that entrance immediately in an hour. And then the focus survey tool in and of itself. Along with that are the resources and handouts that we have available that complement this as well. And I really can't ever say enough about Hugh Heaton. I'm becoming one of his biggest fans, and if you've ever been familiar with the Heaton manuals, this is the author and the father of the Heaton manuals. So it's been a tremendous honor and privilege to be able to work with Hugh through a number of these presentations that we've been doing. We will turn it over for Hugh to go over the packet that he has created and he's providing basically as a free of charge to ensure that everybody has what they need to be successful in the event you are selected for one of these surveys. So how are you going to be selected for this survey? It's not going to be based on just having an active COVID-19 infection. You don't necessarily have to have one. This can be predicated upon by information that's reviewed in a number of different areas, but the biggest is almost going to be complaint allegations, unless, of course, you do have an active COVID-19 case, or you have multiple ones where there's a concern over the infection control practices in the center that could definitely institute or be the cause of having one of these surveys. So if you do have an active COVID-19 case, the survey team has a responsibility to contact the state agency, the Department of Health, as well as CMS regional location to coordinate the survey activities. There should only be 2 surveyors coming in, 1 to 2, maximum of 2 to come in to do this on-site review, but they must be medically cleared and they have to bring their own personal protective equipment. They're not going to pirate anything from the facility while they're there, but they have to be medically cleared before they arrive and bringing their own PPE that may be required on site. What are they doing from an off-site prep standpoint? Well, they're going to review the facility reported information, and we know there's some reporting requirement changes that are coming. Hugh will speak a little bit more to that, some of the releases that are coming as well, anticipating when that information may be more readily available or have more detail associated with it. But either disease reporting or event, negative event reporting. They'll look at the CDC, the state, local public health reports if they're available. Do we have an outbreak? Or are you currently dealing with one? And they'll review the availability of hospital information. What residents who, either from an exposure risk standpoint or active COVID-19, were transferred, either from the hospital to the facility or from the facility back to the hospital. And then, of course, the joy of joys is complaint allegations. They're very difficult to keep primary in our heads, but as hard as this is on us, it's equally as difficult for the families and the residents to deal with all of the restrictions that have been applied in response to this for safety's sake, but not all families or residents will deal with it well. Coping strategies vary, and oftentimes when there's fear associated with it, that may come out in complaints to the Department of Health. So probably one of the things that will induce this more so than anything else will be complaint allegations against the facility. The additional offsite that they're going to be conducting is they really are going to focus when they arrive at the facility on observation. We will talk a little bit more about this. Anything that can be done on an offsite review will be done on an offsite review back at the field office. There'll be additional surveyors supporting the team that may be on site. Those things may include your medical record review, any interviews that could be conducted by a telephone. Those interviews could be staff, they could be families, physicians. They'll look at your surveillance policies. They're going to be looking completely at your policies and procedures for infection and prevention control. They'll look for first onset of symptoms, look at the surveillance tracking, and they'll look obviously for both staff and residents, and staffing has become quite the focus on this as well. How's the facility communicating information to both staff, visitors, and health officials? And everyone's intimately aware of the guidelines that have been released for that as well. The 12 hours and 72 hours. And well, again, Hugh will speak to all of that in the handout as well. But that's certainly taken a big focus and a big push with the release of the information, not requiring it yet, but strongly urging you to do that. And then review the facility's infection prevention and control program, the policies and procedures. All of this can be conducted off-site. This is a review of, what the facility has established as either their practice, their standard, their guideline, or the guidelines from the CDC or CMS that should be adhered to. And they'll look at the emergency preparedness plan, including emergency staffing. I think a lot of us think of emergency staffing in response to either an exposure or a positive COVID-19, a positive illness, and what are we doing in those events where staff can't come to work because they haven't been cleared. There's new information on what we can do to monitor staff to be able to return to work. But some of those emergency staffing situations can arise because when they close the schools, every nurse with a school-aged child had to figure out healthcare. Or they may be a provider for an adult. They may have adult caregiver responsibilities, and now there's nobody to support that. So those types of emergency staffing situations as well, and what you can do to try to be prepared for that or develop abatement plans essentially for when that hits. The other thing is on-site. Now we're into the on-site, I apologize. You have to be prepared to provide the survey team the following. Staff training records, especially for infection control practices, the hand hygiene, the use of PPE, et cetera, for current and new staff is paramount. Staff have to be trained to this. There should be competencies associated with that as well. And you need to be prepared for what may result in rapid onboarding of new people. That could be volunteers or agency. You may have staff members who are assisting with duties that they've not ordinarily been responsible for, had they been appropriately trained and had a competency completed for them as well. They will look for this information on site, especially in response to observed practice. They'll look at the process for cleaning, storing, handling soiled linen and laundry. They're going to look at your cleaning and disinfecting of non-porous surfaces. I think they should have said surfaces, actually. So your med carts, your counters, etc. Don't discredit things like the tech that may be used. If you're using an iPad, how is that iPad being cleaned between uses? If you have wall-mounted kiosks, what's the disinfection protocol for that? I mean, it's to look at those high-touch areas like phones and doorknobs is simple, but we sometimes overlook the tech and the keyboards and the computers that we're using and how that's going to be cleansed in between. Do you have a cleaning schedule for the common areas, the bathrooms, the resident rooms, those high-touch areas? What's the frequency? Is it, again, adhering or following the guidelines? What's your process for distributing water, ice pitchers to the residents? And this is something that was a very easy hit before COVID-19 ever hit. If you're leaving the ice scoop inside the ice, has everybody been trained and educated to that? And do you have the competencies to show that? And again, competencies and training are very much going to take a forefront in the event that they identify something through observation that requires follow-up. What's your outbreak response plan? And are you following your protocols related to staffing assignments and screening? The outbreak response also, coordinates with cohorting and some of the guidelines that were brought out for cohorting. And have you established zones in your facility if you've got a transitional zone for new residents coming in versus residents that may have a positive COVID-19 or are symptomatic, or residents that are asymptomatic but have had an exposure versus asymptomatic with no exposure? If you've got that in like a cohorting plan, or that's part of your outbreak response plan, are you adhering to the guidelines that you've set and the guidance that's been issued? The protocols related to staffing assignments and screening, et cetera, ensuring you're doing temperatures for the staff that are coming in, you're routinely monitoring the health and well-being of your staff. Are staff being assigned, if you are working with the symptomatic or positive population, trying to stick to mainly that population to avoid transmission-based issues as much as you can? That's always going to be something you have to do a risk versus benefit on, depending on your staffing situation and your availability. Are you following the instructions related to fit testing for the N95 masks if you have them and if they're in use? And then, of course, your surveillance and monitoring of COVID-19, the infection rates for both staff and residents. We've always monitored the infection surveillance for residents, maybe not quite as rigidly for staff. It's every inch is important. And of course, with this survey focus for infection control is not unique to COVID-19. The changes in the requirements of participation in phase 3, infection preventionists, the antibiotic surveillance, this has been coming for a while. Now COVID-19 basically put teeth to it. They are really going to focus on on-site observation. We used to joke about, the number of tags that you receive on a standard or a complaint survey. A certain portion of those are generally related to, if you're getting citations, to information or documentation found in the record. But it's surprising how large of a portion are based on observation. Things that are within your control, you can only do so much about what is present in a record. What they see when they're there is what you've got, you do have some measure of control over. So Do you have signage posted in the entrances in the resident rooms? Is that information publicly displayed? How are we screening the staff at shift change, your entrances, limiting non-essential staff from coming in? Of course, the limitation on visitors as well. Where's your location of hand hygiene stations? Just that type of stuff. It's all in the tool as well. They're going to look environmentally to see what's happening in the facility. They will interview staff. They're going to ask them about their knowledge of your infection prevention and control practice, policies, and procedures. If they cannot answer a question specifically related to some of the risk for COVID-19, transmission-based precautions, that alone could bring a measure of a finding of immediate jeopardy. I've unfortunately been in situations where a staff interview related to emergency procedures where they answered incorrectly resulted in immediate jeopardy. So if the staff are not knowledgeable about what the guidelines are that they should be adhering to and your practice, that's going to put you at a high level of risk. Your surveillance protocols for identifying signs and symptoms, how are we monitoring? We know we have high risk population in terms of having a negative consequence if they do contract COVID-19, having a severe response. Are we doing anything specific to monitor them? And then your protocols for notifying local health officials of infections. And of course, there's been some expansion of that that again, Hugh will get into as well. So the entrance conference worksheet, when they first walk into the building, they're going to do a brief entrance conference. They'll inform the administrator of the limited nature of the COVID survey, the reason they're there, and then of course there's a modified entrance worksheet that they'll provide to the administrator. Now, in that modified entrance worksheet, it's not like your standard or complaint survey entrance worksheet. It's very focused to the COVID-19, and they will ask for certain information immediately upon their arrival. And then again, depending on the situation of the facility, immediately there can be some latitude based on the surveyor, what their expectations are, what you're currently dealing with from either an outbreak or a staffing crisis standpoint. But they want the census number, an alphabetical listing of all residents and room numbers, including any residents that are out of the facility. They're going to look for a listing of residents who are confirmed or presumptive positive for COVID-19, and the name of the facility staff responsible for the infection prevention and control program. Within 1 hour is everything else on the entrance conference worksheet. That includes the working schedules for your licensed and registered staff for the survey time period. So they want to look at to see who's actually on site. The listing of key personnel, location and phone numbers. That list can also be used to conduct those off-site phone interviews. Any contract staff, rehab services, or anybody you have in the facility, how to access the resident's electronic health record. Most people at this point in time have an EMR of one form or another, ensuring that they have access to the EMR while they're on site, so they can pull any information relevant for their review. But most of the record review, medical record review, is going to be completed off-site. If they can't access the EHR remotely, they will request that they want to access it remotely. Most EMRs have that capability to allow for remote access. One caveat I would give is usually you can set a limit or a time limit for that. If you forget to turn off the remote access, then basically the surveyor role that you've created is going to be wide open for anybody on that survey team to look at information whenever they want to. So you do want to probably lock that access down to the time frame for the survey. But again, if they're doing off-site, that remote access is going to be essential and necessary. Name and contact information for IT and backup IT questions as well. Additional information is going to be, they're going to ask for specific policies and procedures within 1 hour of the entrance. But again, the review of this is probably going to be conducted off-site. They'll look for your infection prevention and control program, including the surveillance plan. They're looking for compliance with F880. They're going to look at your emergency prep, especially staffing strategies, policies and procedures for volunteers, and again, the screening and education. What tasks are they performing? It is really observational focused on how people are preventing transmission or are utilizing transmission-based precautions, utilizing personal protective equipment, utilizing hand hygiene. The off-site review, if they're unable to do the off-site review for the EHR, then you're going to either print or photocopy whatever medical record information is determined by the team that they need to determine compliance or to support identified non-compliance. So in the event that they can't do the off-site review, you do not have the capability to provide that to the EMR, then we'll be making copies or printing. The focus survey tool, they're going to use this tool during, they provided this. It's not something that's hidden, unknown. It was very transparent when they put the OCS letter out regarding the focus survey protocol, but they include certain critical elements, and it's known to us, so you can use this exact same tool to best prepare for this as well. Again, we've talked about standard and transmission-based precautions, especially, they'll look at residents that may require or may have an aerosolizing procedure like suctioning or mini-neb treatments or something with the harsh coughing versus the droplet or the contact or the standard. How are you implementing those, and are you implementing them in accordance with the guidelines? The quality of resident care practices, especially including COVID-19. There's a lot of waivers out there for group activities and things like that, but are residents being treated in a dignified manner? Are we doing everything we can to avoid cross-contamination? Or again, are we practicing appropriate hand hygiene as we move between populations? If you've got cohorting in place, are you following the guidelines? Your policies and procedures, all part of the review as well for the focus tool. The infection surveillance plan, part of that as well. And your visitor entry and facility screening practices are going to be huge as well. Remember, education, monitoring, and screening practices of staff and your policies and procedures in an emergency are all going to be open to review. And the intent is that you're following the CDC, CMS guidelines in your own facility policy and practice. Now, the caveat, of course, to this is anytime the surveyors enter the facility, while the primary focus is COVID-19, they are instructed, even in this abbreviated survey, to investigate any other areas of potential noncompliance where there may be a likelihood of immediate jeopardy. Something to think about is if they identify something that it may rise to the level of immediate jeopardy, and it's based on an observation of a practice, if you do not have the matching education, just word went out of my head, competency that went along with it, that could be, you'll wind up getting these add-on tags, basically. Not to say that they'll pile on, but this could spread to multiple different areas, not just the infection control practice. It could be your facility assessment, it could be education. So if this goes south, there's a chance of tangential tags being picked up in response to this as well. Remember, everything's open to review as soon as they come into the building. So that's quite a bit to go through and relatively quickly, but it's sort of a quick level overview of the focus survey protocol. What I'm going to do now at this point in time is I'm going to turn this over to Hugh Heaton. Again, he has done so much work and so much effort into ensuring he researches everything that's coming out of the CDC, from CMS. He gets on training sessions for different state agencies across the country. He's really amassed this information into a really wonderful document that allows you to be able to utilize this, to be aware of all the information and guidance, as well as how you can prepare and respond in the event that you have that. So with no further ado, Hugh, the floor is yours.
Thank you, Greg. I hope you can see my web or my screen. You're looking at the burn rate calculator I'm going to start out showing you handout number 2, and then we'll go back to handout number 1. But this is the burn rate calculator that you see information about. CMS updated this calculator. It's much easier to use, and so it's an Excel spreadsheet. It's all of the formulas are pre-entered. When you enter the data, it's automatically going to calculate your PPE usage. And they're going to ask sometimes when they come into your facility, they're going to ask if you're using this particular spreadsheet. It does have the instructions, and so you're able to maneuver back and forth really easily. They did a much better job on creating this. So the next thing I want to look at, though, is our handouts. I'm going to bring those up, and we're going to look at handout number 3. For those of you who want to train your staff on the focus survey process and go much deeper than what Greg was able to do, because it's just such a major area. He did a great job on reviewing the highlights of that. But what we've provided for you is a set of slides in PDF format that you can utilize to train your staff on all of the focus survey process. It's in the survey notes as you go through the information. You're going to have notes that will guide you into exactly what the information is about. You'll find it extremely easy to use. It's going to follow the same outline as the handout number 1, which contains all of the data and the reference sheets. We put this separately because it's such a large document. And if we added it to handout number 1, it would be probably a 10, 11 megabyte document. Be extremely difficult to maneuver. So we've made it separate, but it's exactly the training outline to teach your staff, or they can read the slides themselves if you want to do that. It's just so easy for them to follow the training material. Handout number 4 is the one that we've had a little trouble with in getting it to open from the site. But this is the most current document that CDC has released on the return to work criteria. I was listening into a state survey agency program today, and they referenced this document 2 or 3 times. It's broken down into return to work criteria, the particular test criteria, return to work practices and work restrictions, and strategies to mitigate healthcare personnel staffing shortages. So it's the most current document that CDC has released. They may update this again. Sometimes they update these documents every couple of weeks. We do monitor that, but this is the most current one today. But I want to go back to handout number 1 and spend my time here going through this particular document because it is packed with information. As a former administrator, trying to locate data, and there's so much information coming out on compliance requirements. You do this, you do that, but what a lot of the agencies do, they link it to data. What we've tried to do with this particular document is bring all these documents in one place so that you can have access to all of them without having to search for the data. It has a table of content, and you'll find that the data is linked, but it's also bookmarked. You can use the links or you can use the bookmarks to go through the data. The first thing that we wanted to show you is these are the actual surveyor training slides that the survey team was trained on by CMS in March. These are the actual slides. We went through the data, and where they talked about information, we created and located the data and linked it for you. Here again, it's still here, but if I wanted to look at from this page, I wanted to look at Memo 2020, I can just click on that, and it'll take me right back to the page. So as you go through the slides, you're going to find everything that the survey team has been trained to look for. We took that document along with other QSO letters that's been released, and all of that has been put together in this one document. But these are the slides. So you may want to get your staff to look at what the survey team has been instructed to look at and how they're to look at that. They were instructed to look at this particular summary table. It's going to provide, and Greg went through a lot of that, what they will do off-site, what they will do on-site, and then the facility assessment, and we're going to look at that a little bit more in detail. The other document that they are instructed to look at is the focus survey protocol. This is a set of guidelines to the surveyor on how to do prior to the survey. These are the things that we want you to do to prepare. And then when you look at that, and you'll find that these are the bookmarks are very comprehensive. So you can open up the bookmark and find what you're looking for very quickly. What they're going to do prior to the survey, what they want them to look at on the on-site, the entrance conference, all of those, and are instructions to the survey team on what to do with these. And then even how the visit, the concluding the survey, the exit conference will be conducted by phone. So you'll see this document contains a tremendous information for you in seeing what the survey team is looking at. The other document that we've looked at, and Greg mentioned this, is the entrance conference worksheet. This is the actual form that they are instructed to provide to you when they come into the facility. They will provide you with this form, and it contains what they're looking for immediately, what they're going to do on the entrance conference. It's just like the current entrance conference, but it's modified strictly for the COVID-19 or infection control issue. We'll come back to this particular form in just a second. There's a couple of things I want to go over with this one. The other things that's provided in this document are the latest QSO letters that deal with these inspections and reporting requirements. QSO letter 20-26 was released a week or so ago about the reporting requirements. That information has not been released yet. However, based on some of the calls that I've been able to participate in, it may be that they're going to release this information Friday or maybe early next week. And the reason I say that is that CDC is conducting 2 webinars tomorrow and Friday. The first webinar, and I believe I might have let me look and see. I do. Or I thought I did. There is a document, and we'll get that to you, that gives you the website addresses on where you can go to attend these CDC webinars. There's 2 of them. The first one is an hour-and-a-half session tomorrow afternoon from 1:30 to 3 o'clock on the form itself. And then the next day is at the same time they will do a second webinar on enrolling, how to enroll to provide this information. So apparently what CDC is requiring is that you must enroll in order to provide the information. Basically, there are 4 parts to it. So since CDC is releasing that information tomorrow, it seems that CMS may release their guidelines, reporting guidelines as well. So that document is here. One of the things I wanted to point out in this particular document is the ongoing public health surveillance. And some of you may have already participated in some of the COVID focus surveys. But what's taken place is that CDC is permitted to come into your facility and participate in the survey process, or even come in and do not necessarily a survey, but they are going to look at how you are providing and conducting infection control. They are citing this particular rule. Let me bring this up. It's a resident rights. and it's tag number 562, where it provides the purpose of these visits will be for CDC or its agent to perform on-site infectious disease surveillance. On a call that I was listening to this morning, the state agency indicated that CDC is not providing what they find to the survey agency unless they identify an immediate jeopardy issue that Greg talked about. So they are coming in. You have to allow them to come in, but they must follow the same guidelines as the surveyors. They have to bring their own protective equipment, and they have to be medically cleared. This one is QSO 2020, which deals with the prioritization of the survey activities. We know what they're doing, and this talks about a couple of things that we want to go back and look at. One of them is the focus survey form, and the other one is a self-assessment that CDC and CMS sent out back in November, and we're going to look at that. We're also going to look at 2014, which deals with a lot of the restrictions that were placed on nursing homes. This QSO letter is still in effect based on what CMS is saying and the state agencies are saying. This will stay in effect until phase 3 of the reopening of America will go into effect. You will have to follow these guidelines. Greg mentioned looking at the emergency preparedness plan, and what they're looking for in that particular plan is policies and procedures for volunteers, and that does not come from the F tags. That comes from the E tags. So your handout, in this handout, has that particular rule. So you may want to just review that. It also contains all of the F80 regulatory process. There are your CDC and OSHA guideline documents relative to optimization, relative to respiratory. There was a new OSHA requirement released Friday on enforcement guidance on decontamination of filtering face mask respirators. So that's the most current document that OSHA has released. OSHA is doing inspections based on complaints, and they, based on what I've been reading, they are doing a lot of them. So you want to make sure that you're in compliance with these particular OSHA documents, and every one of them is right here. On April 2nd, CDC released this particular piece of information. And a lot of the documents that CMS has released since that time, they reference this letter. So be sure that you take a look at this particular document. It's got tremendous information about how to handle certain situations. Long-term care facilities should implement symptom screening for all. So these are the latest instructions on what CMS is expecting the facilities to do, even when they are having difficulty finding protective equipment. If they're looking for, when they come into the facility, not that you have it, is have you show me the documentation that you've attempted to get it and why you're not able to get it. So you want to take a look at that. They released last Friday QSO letter 20-28. It's got several questions and answers in it. I pulled these last several questions because they deal with the focus survey. On March 23rd, CMS released a memorandum. We just looked at that. Can you summarize the intent? So it gives a summary. I'm not going to read all of that, but it gives a summary of what that QSO letter is about, and we've discussed it. It's about the survey process. But then it asks this question. Includes a new focused infection control survey process that facilities can use as a self-assessment form. What is CMS's expectation for the voluntary infection prevention and control self-assessment? That self-assessment, there's two different forms I want to share with you. The first one we know is the focus survey process form. If you are surveyed for the COVID-19, they're going to use this form. It's also called and referenced in the QSO letter as a survey assessment tool. We had some confusion about, is this the form, is it the self-assessment tool that you're talking about? And they said, yes, it's the same form. So what they're looking for is the surveyor's review for these things. Greg went through all of those, but it's asking different questions. So you want to make sure that you're looking at this. They are going to ask you if you've used this as a self-assessment. Go back and pick up that form. They want you to use this form as a self-assessment. But there's also another self-assessment form that they are maybe asking you to, it's not mandatory to use either one of these forms. It is mandatory for the surveyor to use this form. They have to use this form, and they will answer all these questions. That's required of them to do that. So you can look at that. When you're looking at one of the questions, I want to go back to it. One of the questions was about blood pressures. Let's see if I can find that. Should nursing homes screen surveyors as they enter? Does the self-assessment count as an official survey? It does not. Section 4 of the COVID focus survey form, what they wanted to know is, do you have to take blood pressures every day? So this answers that. But where that comes from is Section 4 of the COVID form that we've been looking at. It comes from this one. It comes from this question right here, the fourth question. So they're explaining a lot of that from these questions. But the other focus survey tool that you may want to look at, it's a self-assessment tool. This was released in November of last year, QSO letter 20-13 or 20-03. We have created a table of content and it's linked. So if I want to know about my hand hygiene practices, this is a self-assessment tool. Have I completed all of these things? It's an 18-page document. So as you go through it, it asks all of the different questions about, when you go back through and by the way, this is also bookmarked. So you can go to any section, surveillance. So if you use this form, I would also encourage you to use it in conjunction with the focus survey form that we just looked at here, the focus survey 2. So that if you go back and when we look at those letters, they are encouraging, when you look at these questions, they are encouraging families to ask this. CMS has also encouraged residents and families to ask the nursing home if they've completed the self-assessment and what the results are. So it's not mandatory, but they are encouraging. Even though we say it's not mandatory, being an administrator, I know that I'm going to look to see if they say they're not doing it. I'm going to dig deeper. It's going into the QAPI, and what they're looking at is if you're not doing this, they're going to cite tags 855, 865, 66, and 67. That's where they're headed with this, going to your QAPI program. So this is a very detailed handout. It's 142 pages, but it's linked. If you use this in addition to this training program, you will be extremely informed of what the survey process is about and how maybe to avoid some deficiencies. So with that, Dahlia, I will turn it back to you for any questions that we may have or any comments. Be happy to answer those. And if you have my contact information on the slides, and if you want to call me or send me an email, I will respond.
Well, wonderful. Thank you, Hugh. And we do have a couple questions. Thank you for everyone that has been asking those. The first one is, do we have to let families know of a PUI?
Uh, that was asked on the question this morning from the surveyor I was listening to, because the reporting requirements are not finalized yet. We don't know. We're assuming that information is going to be put in there. It depends on their symptoms, I'm sure. We don't know what all the reporting form is going to require. So that's the best answer I can give them. We don't know.
Right, wonderful. We have had a couple questions about the handouts. Those of you that are having trouble downloading the handouts, we will also send those out. And those of you that are asking about the recording, we are recording the session and it will come to you in a follow-up email. So, you can look for each of those. And other than that, I think we have all of the questions answered. And with that,
Well, Hugh, this is Greg. I would just want to ask one question, sort of in general, not necessarily to the focus survey process, but something we have been discussing in response to states applying for or soliciting for immunity in response to COVID-19 cases. Would you care to remark on that at all?
What I'm reading on that is that states are petitioning for immunity. Where the danger lies in that, even though the state or the facility may be immune from deaths in the facility based on COVID-19, the immunity does not apply to the survey process or to the enforcement remedies that will be placed. Also, if in the survey process, if the citation is cited as negligence, I think that will be exempt from that. The other part of that, even though the states may allow that, currently the Department of Justice has not ruled on that, and it's my understanding that even the states may try to do that. It's my understanding that the Department of Justice has to sign off on that. So there's a lot of confusion about that. Some states have already done that, but it's not going to apply to the survey process. It will only apply as a private lawsuit or a lawsuit as a result of the COVID-19.
Hugh, there's one last comment. Someone has commented that they are currently in this focus survey right now, and this education is spot on as to what is being done. So they're very appreciative that you're sharing. And for everyone out there, this comment came from someone that is currently going through this exact survey. So thank you so much for this.
Well, a lot of those things that Greg went through on the slides are things that we were able to get from facilities who are actually have had the survey. In addition to the CMS survey, now you're looking at the OSHA. So you think that we get through one hurdle, now we have others. So my heart goes out to them. I had a lot of hard days as an administrator, but I never had anything like this. I can't imagine what they're going through. So my heart goes out to them. And anything that we can provide to you, we want to do that.
Okay, well, thank you so much. And Greg, is there anything else that you'd like to add?
No, just appreciate, if I can echo Hugh, just the appreciation for what everybody is going through and what you're struggling with right now. And again, my heart goes out to you as well. The media coverage has certainly not been favorable for long-term care facilities. I heard one person for quite a while now, I heard somebody say that a death in a hospital is a statistic and a death in a nursing home is a news story. So, the media practice surrounding this as well has been a bitter pill to swallow for some, but just know the appreciation that we have for everything that you do in caring for others, and our hopes and prayers are with you, and thank you so much.
That was awesome. Thank you, Greg. And thank you, everyone. And with that, we conclude today's webinar. Thank you, everyone, for what you do. We really appreciate you. Bye-bye.